Advanced practice providers like nurse practitioners can be a very important member of the multiple sclerosis healthcare team. Nurse practitioners like Stephanie Agrella can help patients with their problems in between the time that they have visits with their physician. In my practice, the nurse practitioner does this, helps manage patients' treatment, symptom management, issues with drugs and side effects, and other social issues.
Hello, my name is Stephanie Agrella, and I'm a nurse practitioner. I work with a team of healthcare professionals providing care to individuals who are living with multiple sclerosis in an MS clinic in Central Texas. I'd like to talk to you about living your best life. I think despite having a chronic condition, you can still achieve wellness and health, and you have a team of healthcare professionals behind you to offer their support. Let me tell you a little bit about myself. I started my career as a nurse practitioner working in primary care. The majority of my time was spent providing care for acute issues, things like ear infections, sinus infections, even animal bites. But I also spent a great deal of my time managing chronic conditions, things like high blood pressure, asthma, diabetes. Prescribing medications was certainly a big part of what I did, but so too was counseling regarding health and diet and exercise. These were all important things for the treatment of these disorders. As a nurse practitioner, I focus a great deal on illness prevention and health promotion. This is essential learning for all nurse practitioners, and in my opinion is essential for the treatment of all patients. When I'm treating people with multiple sclerosis, we are often talking about symptom management, or we're discussing the therapies that we use to treat multiple sclerosis. What I'd like to impress upon you is that you're a big part of that conversation. You're a big part of the healthcare plan. You have a team of highly educated and experienced healthcare providers who are there to help guide you to make good treatment decisions. It's important for you to know that although you have multiple sclerosis, you have a team, you're not alone, and you have a future. We know from research that people who take part in their healthcare decision-making process feel more in control, are more adherent with their therapies, and have better outcomes. I'd like to give you a unique example of a patient who is taking part in their healthcare plan. I recently saw a newly diagnosed patient, and she was in to see me to discuss the therapeutic options for treating MS. I reviewed 2 DMTs with her, disease-modifying therapies, either of which would have been appropriate for treating her multiple sclerosis. I reviewed the risks and benefits and talked about the side effects. I also talked a little bit about how these medications worked. She was very interested in knowing this, and so we talked a little bit more about the mechanism of action for these 2 therapies. Now, either of these medications would have been appropriate for her, but she chose to go with the one that she was able to actually see working inside her body. Now, this is someone who was taking an active role in their health, and she was taking control. I'd like you to be an active participant in your healthcare plan. I want you to leave your appointments knowing that your healthcare provider has done everything they can to help you with your MS. But you also need to know that you need to be a part of that picture. You might be wondering why I work in multiple sclerosis. Well, I love what I do, and I'm very passionate about it. I'd like to help you manage your MS. I'd like to help you live your best life. I'd like to help you be the best that you can be, but you must be an active participant. I certainly have limitations on what I can do. We've come a long way, but as a clinician, I can only do so much. Taking your medications is something you have to decide to do. Not smoking, exercising, taking good care of yourself. These are all things that you need to choose to do and act on. Your healthcare professional can certainly help you up to a point, but you have to take an active role in your health. I'd like to tell you about Megan. She's a patient who recently came in to see me, and she wanted to discuss some ways to manage her muscle spasms. If you have MS, you might know what I'm talking about. People describe this as stiffness, tightness, spasticity. These are all the same words to describe spasticity, and she was really having some difficult times with this. So I discussed exercise, stretching, physical therapy, and yoga with her. These are all great interventions to try to help with this. I also mentioned that there are certainly medications that we can use to help with this as well, but that I prefer we start with those first interventions to see if we can get some improvement. So Megan really liked this idea. She wanted to try the stretching, and she wanted to try to do some exercising. She wasn't really sold on the idea of yoga, but she was willing to give these things a shot. She came back in to see me a month or so later, and was very happy to report that she was doing much better with regards to her spasticity. She had been stretching, and she had been exercising regularly, and to her own surprise, she'd actually signed up for yoga recently. She had really noticed an improvement, and I could tell too on her exam. She was feeling much better, she was feeling like she had some control, and she was taking part in her healthcare plan. Did you know that people who have MS and smoke have worsened outcomes? They progress to disability faster, and their MRIs look worse too. So ask yourself, do you have any unhealthy habits that you can change? Do you have any other diagnoses, high blood pressure, cholesterol, diabetes, that you could have better control over? So when was the last time you saw your primary care provider? When was the last time you had a physical? If it's been a long time, it's never too late. What can you do to make yourself healthier? Try to eat well, exercise, avoid those unhealthy habits, and find joy and happiness in your life. Ask yourself, what can you do to enhance your health? How can you improve your quality of life? And know that your healthcare team is behind you all the way. Ideally, we would have a cure for MS, and someday I think we will. The future of MS has never been more hopeful. Right now, let's focus on you living your best life. You are living with MS, but you have a team and you have a future. Let's work together to help you live your best life.